What are the features of Turner syndrome? So let's take a question. A 10-year-old girl presents to the pediatric clinic with her parents who are concerned about her short stature compared to her peers. The girl's height is significantly below the 5th percentile for her age. Physical examination reveals a webbed neck and wide-spaced nipples. Based on these findings, the pediatrician suspects Turner syndrome. Which of the following physical features is most consistently associated with Turner syndrome in girls and women? Remember that now we looked at what is the most likely karyotype. Now we are looking at what feature on Turner syndrome stands out most in all the cases. What feature of Turner syndrome stands out most in all the cases? What feature? Is it short stature? Is it wide set eyes? Is it polydactyly? Is it microcephaly? What feature? Is it microcephaly? Is it polydactyly? And the answer is short stature. So short stature is the most consistent and prominent feature in girls with Turner syndrome. So they may have the webbed neck and all those things, but the topmost feature is their stature. Okay, it's a hallmark of the condition and often prompts further evaluation for Turner syndrome. So if you see a female who is consistently short, and it is not like a constitutional thing, think about Turner syndrome as the reason. And the reason, the teaching point is wide set eyes, while they can occur, are not as consistent or diagnostic of Turner syndrome as we are thinking. So that is number one. Number two, polydactyly is not associated with Turner syndrome. Number three, microcephaly is not typically associated with Turner syndrome, right? Microcephaly is not, polydactyly is not, wide set eyes may, but that is not the most common feature of Turner syndrome. Next question. A neonate is brought to the neonatal unit with swelling of the hands and feet, which is noted shortly after birth. The baby has a webbed neck and widely spaced nipples. Based on these physical features, the neonatologist suspects Turner syndrome, which of the following is a common anomaly observed in neonates with Turner syndrome. Neonates. So now we are going to neonates. A, congenital lymphedema of the hands and the feet. B, micronathia, that is small mouth. C, macroglossia, that is big tongue. D, polycystic kidney disease. Which of these is a more common anomaly found in children, babies, neonates with Turner syndrome? So what's the answer? The answer is congenital lymphedema of the hands and the feet. So congenital lymphedema of the hands and the feet is a common finding in neonates with Turner syndrome and is due to lymphatic dysplasia. All right? Lymphatic dysplasia. Micronathia is not a typical feature of Turner syndrome. Macroglossia is associated with conditions like Beckwith-Witherman syndrome, not Turner syndrome. Okay? And polycystic kidney disease is not associated with Turner syndrome. So the condition which is most commonly associated with Turner syndrome is congenital lymphedema of the hands and the feet. That is a common finding in neonates with Turner syndrome. Okay. Now, next question. You have a 15-year-old girl with a known diagnosis of Turner syndrome and is evaluated by a school psychologist due to difficulties in special tasks and maths. Her IQ testing reveals average intelligence, but she struggles significantly with tasks requiring spatial awareness and organization. Question. In Turner syndrome, which of the following neurocognitive deficits is commonly observed despite overall normal intelligence? A, language delay. B, problems with visuospatial organization. C, memory loss. And D, attention deficit. Doctors, please try answering this. So, which of the following neurocognitive deficits is commonly associated despite overall normal intelligence? Is it A, language delay, B, problems with visuospatial organization, C, memory loss, or D, attention deficit? And the answer is B. Good, Dr. Marachi, you got it right. So patients with Turner syndrome, they have problems with visuospatial organization, even though their overall intelligence is usually within normal range. So usually Turner syndrome is not like one of those conditions where, you know, there's a concern with the way the patient reasons and the way the patient does tasks and the rest. Most of the time they have normal intelligence, but they have an issue with visuospatial organization. Okay, so now let's go to the teaching point. The most consistent feature of Turner syndrome is short stature. So think about it, female, short stature, think about Turner syndrome as one of your topmost diagnoses in your board exams.